So I am excited to introduce Teresa Thomas, and she is an expert on toxins, and she's going to impart information about how the toxins in our body can affect us during menopause. Take it away.
Thank you so much, Cindy, and welcome everybody. My talk is called Not Crazy, Not Brain Fog, and how the toxins in the world are impacting our health. So I'm sure many of you have experienced that feeling when somebody looked at you like you were crazy and said, "Oh, there she goes again," rolling their eyes. And we know in our own minds that we're not crazy and we don't know what's happening. But then we can also do something and turn around and say, did I actually say that? Because I didn't mean to, it just popped out. So the symptoms that we experience during menopause can be very challenging. And I have to say, excuse me, just 1 second. I was one of the fortunate ones that really had no symptoms at all until I was doing a talk in my 70s. And I had this fainting spell and sweating and everything, which I never ever experienced. I had like three warm moments during my whole menopausal stages of life. So I'm talking more from hearing other people's stories than what I went through. And well, I have to say though, during that time is when I got very, very ill with environmental sensitivities. My immune system was like at the bottom of bottom. So it could be that that saved me from having symptoms because my body just couldn't respond to anything. I'm not sure. My mom had no symptoms though, and my aunt had to be on HRT for the whole of her life until she was like 90. So she actually tried to get off and could not get off because the symptoms were so dramatic. And she was also a real health nut. So it's not always for everybody that what you change will help you. But my big story is to get rid of the synthetic chemicals as much as possible in your life. And my big story is the laundry products. Because if we're always surrounded by scented laundry products, our body does not get a rest and doesn't get a chance to detox. So that is my big thing. If you can stop using scented laundry soap, detergent, that would be the best thing. And fabric softeners and dryer sheets. So those are the three things to eliminate. I know it's very, very difficult because here we are in a world where they're telling us we all smell bad and we need to cover up our body smells. And if you didn't do that, everybody's going to reject you and nobody's going to come in your house and they'll be making faces and et cetera, et cetera. So we know this is marketing and we have to just bite the bullet and say, okay. Now, in my house, anybody that lives here has to go fragrance free because I'm so severely sensitive to the fragrances. And then they start noticing all the other smells out in the world because when they have it on all the time and when you're wearing clothes, it's going through your skin. When you're sleeping in sheets, you're breathing it all night. So your body doesn't get a chance to rest. And we need to have our liver and our kidneys just cleaning out the basics, not having to clean out all the overload. And of course, they're trying to clean out the overload and it's too much. So then our symptomology goes up and our ability to just respond in a normal way to all the things that are around us is depleted. So the other thing is there was a study done, this comes up in my book, which is coming out sometime this year from Toxic to Green, the New Parenting Guide for Maximum Family Health. And I will be doing one for women, which will get into a lot of the issues for women from breast implants to, I don't know what. How about, what is it called? Cosmetic surgery. hair dye, etc., etc. All of things which are problematic for our bodies. So to be able to let those things go and try to be as natural as possible is important. At any rate, I was saying, can you remember what I was saying, Cindy? I was going to make a point. Uh, uh, it's gone. Okay. Oh, yeah. No, the dryer vents. So this is in my book. And somebody back in 2013 went and got a machine and went by a dryer vent. And they found 25 volatile organic compounds coming out in the air. And of those, 7 were hazardous air pollutants and 2 were carcinogens. So if you think about that, what's on your clothing has all those things in it because it was in the dryer all that time, and those are going through your skin. So we want to reduce that as much as possible. Now, the next thing is, well, we could talk about everything from deodorant with aluminum in it and scented deodorant. But the next thing for me is your bed, because that's where we spend most of our time if we're getting the sleep that is suggested for us. So again, your bedding, to have your bedding materials all washed in fragrance-free soap. But the mattresses, many of them are sprayed with fire retardants. So you want to be able to ensure that you can have a mattress cover or layers underneath your sheets and your mattress cover to protect you from all of those chemicals coming up and being around your body as well. Okay. The next thing is your body creams and lotions, and to be looking around for that. My dermatologist said, buy the cheapest product possible. Don't go spending a ton of money on these things that are all full of extra chemicals and extra scents. So that's a big thing to do. And I had a product, it was $12 for a skin cream, and it lasted like 3 months. And it was the most beautiful skin cream. They've stopped making it, so that can be pretty difficult. But to be able to look around for the products that have the least in them, and then be really conscious of what you're doing with that. Now, I'm going to have to take a miniature break. I'm going to be here, but my brain has stopped working. This is a menopausal system that goes along with multiple chemical sensitivity.
So,
And yes, go
do
ahead.
you think you could talk about what you did in your area about stopping a terrible situation? I think
Oh,
that would be
sure.
very informative to people.
Oh, I'd love to share that, and I can do that quite easily. Thank you, Cindy. So, um, I live in Halifax, Nova Scotia, and here we had a big hospital injury where 800 staff got sick with multiple chemical sensitivities. Now, I did not work there, but where I worked, we also had a methane or a sewage leak under my desk, and I was breathing methane in small, tiny amounts for a long period of time, plus some things that were in the heating system. So I'm going along, and my brain fog is getting terrible. I cannot think, and I've got 6 projects, and I have to have a binder for each project when I go to a meeting, and I have to write down everything. It's rather embarrassing. They all thought I was, really dumb and incompetent, which I knew I wasn't, but I had to have these tools to help me. And anyway, eventually, my body collapsed because of those chemicals. And there's a saying, low levels, high stakes. So if you work in a factory and they have a formaldehyde spill, of course, everybody vacates, they detox everybody, send them for saunas or whatever, or give them medications to help detox all the chemicals. But if you just have tiny little bits, your body doesn't even see it as a problem. And back with the formaldehyde, they'll be throwing up or having runny eyes or whatever, right? But if you just have a tiny bit, your body doesn't even see it as a toxin. So it's very important to be aware of your workspace and your home. Again, what is there? So we were renovating at home. At work, we glued down the carpet. I painted some pipes with red oxide paint, which I guess is very toxic. And I was just painting away. And anyway, along with all the people from the hospital, myself and a couple of other people got environmental illness. And the community just expanded because there were so many people. Everybody in Nova Scotia, which was about 2 million people at the time, everybody knew somebody. So we had the Allergy and Environmental Health Association. We had real alternatives for toxins in the environment. We had the Citizens for a Safe and Learning Environment, and many, many other organizations. The Nova Scotia Network, Environmental Network, which brought all of the organizations together. We were a going thing. You'd have the Allergy and Environmental Health meeting, and 200 people would show up. So it was a big thing. And consequently, in the province, the biggest thing that was bothering people was perfume. And I don't know if you know, but perfume has orris root in it, ORRIS, I think, root. And that is really the thing that carries the scents. And everybody was reacting to that. And a lot of the people from the hospital were nurses and they wanted to go back to work. Well, of course, everybody wants to go back to work. You don't want to be homesick all the time. So they made a poster called No Sense is Good Sense. And it's a little skunk. Well, no, they didn't make the skunk. I'm not sure who made the skunk, but the skunk is a proprietary poster. So I don't have permission to show it. But everywhere you went, universities, hospitals, schools, stores, buses, everything, everyone was plastering up the signs, no sense is good sense. And if you were wearing scents, you were kind of ostracized because people just couldn't tolerate it. And I can say, I'll just tell this little story. It's in my book. Um, the the sale of scented products plummeted in Nova Scotia. Like everybody stopped buying scented products. So there was an organization called the Cosmetics, Fragrance, and Toiletry Foundation, and they came down to Nova Scotia and they asked the Dean of Medicine to gather all of us together, Nova Scotia Nurses Union, Canadian Union of Public Employees, all those other organizations I mentioned, so they could meet with us. So, you know, we're all totally naive, I have to tell you. And so they said, well, you know, I see you're concerned about perfumes. Now, what is the problem? Well, we get sick when well, you know what? That's just the little old ladies. They don't know how to wear perfume. And of course, you've got perfume in your hairspray, perfume in your skin cream, perfume in your clothes. Anyway, most of us were over 50 and we were women. So when he said the little old ladies, you can just imagine the energy that changed in the room. Then he says, well, who is funding these posters? You have quite a poster campaign. That's really amazing. Who's funding them? Now you can figure out what he was trying to figure out. Like which funder could he go to stop the funding of the posters? And we had Rona Cathcart, who was the president of the Nova Scotia Nurses Union at the time, and I always describe her kind of as a little bulldog. She had jowls and she was very short. She puts her fist down on the table, leans forward, and said, "Oh, we go and make the copies ourselves, and we take them everywhere we go, and we put them up everywhere." So that was kind of the end of the meeting. Now I was at the end of the table where this fellow and his colleague were sitting. And he came back to his colleague and he leaned over and he said, "We'll just have to start advertising to the children." Now, anytime I tell that story, I just get chills. And my daughter was around 9 years old. And that fall, all the girls were spraying their dolls with perfume on the advertisements on the television. And I just said, well, you know, I'd love to have enough money to get a Super Bowl ad.
Question.
Wouldn't
Have
that
you
be
ever,
great?
anyone ever walked into a room and you forgot why you walked into that.
Yeah, there we go. So anyway, we had to deal with that. And now, what is it, 35 years later or so, uh, people don't remember. And we have 20-year-olds that are so sensitive they can't go to university and this kind of thing. So it's very, very critical. The other thing is, I've got my other two things back now. Thank you. Well, I got sidetracked there. Number one is disinfectants. Now, they got us. During COVID, they got us. You got to disinfect everything, practically including the food you eat. And so just remember that disinfectants are poison. They're a poison. They're there to kill things. So the other ad that drives me crazy is the one, I'm not sure if you guys have it, but anyway, somebody comes home and they disinfect the counter and they disinfect the stair railing, and then you have these 3 and 4-year-olds running up the stairs, hanging onto the stair railing. And where is that product going? It's going into their skin. So we want to just reduce the things that we're putting into our skin. And if you're the one that's wiping the counter off, they're going into your skin and your lungs. So I just say, just don't do it. And the other thing is the plugins, and even diffusers. Too much of anything is too much. And the plugins and cigarette smoke, if you were buying a house, you can walk in, you can smell the cigarette smoke, and you know it's never going to come off. It's never going to come off. Well, the same with plugins. It just doesn't come off. So imagine how long it's, well, what I say to people is, okay, just if you stop wearing scented products, it's probably going to be 2 weeks before you really start noticing anything, or a month before you start noticing anything out of your body. And your clothing, it's probably going to take 3 months. So these things are coming into your body all the time, through your lungs, through your skin. And it's just really important to reduce them as much as possible, because what they do is they disrupt your endocrine system. And then everything is out of whack, like Joyce was talking about, the liver and the kidneys. They can't deal with it all. And so all of the other resilience that our body may have isn't able to function and cope. So since World War II, there have been 200,000 synthetic chemicals added to our environment. And since the early 90s or the late 90s, when there was 90,000, 110,000. So you can see what we're having to cope with. And the less you can have in your home environment, the better. And of course, drinking out of plastic. Just don't do it. Don't cook with plastic. Don't drink out of plastic. Get a water filter that you can have on your counter and have good, clean water. And I saw a fellow today. I'm not sure how my time is going, Cindy. I saw a fellow.
It's wrapping up.
Yes, okay. I saw a fellow today on Instagram who had water out of the tap, and he had a little bottle that will show you how much chlorine is in the water. And he put he made 2 bowls, one hand in one bowl, and then the plain water in the other bowl. That showed a significant amount of chlorine. When he took his hand out of the other one and put the drops in there was hardly any chlorine, because it had all gone into his skin. So look at water filtration, air filtration, and just changing your products so that you're not overloading your sensitive, wonderful machine of a body with things that it doesn't need to have to cope with. Thank you very much.
Wonderful. Thank you so much for your wisdom about taking the toxins out of our space, especially with personal products, and things that we think are not harmful can be. So just pay attention to the natural world. That's why humans were built to be part of our biosphere. Thank you so much.
Thank you, Cindy.